Hi, I'm Lee Kelso, host of the Health Call Live Radio Hour. I'm glad you're here. As we approach year 2 of this global health emergency, the American Association of Critical Care Nurses is stepping forward with a campaign called Hear Us Out. It puts critical care nurses front and center to tell their stories of caring for patients. The goal? Convince the vaccine hesitant to reconsider. Beth Wathan is president of the AACN, a clinical practice specialist in the Pediatric Intensive Care Unit at Children's Hospital in Colorado. Beth, what's the key message of the campaign?
Hear Us Out is a public-facing campaign, as you mentioned, Lead. And really the goal was to speak out boldly on behalf of nurses and to create a platform to amplify and share their experiences throughout these past 20 months. And we are also imploring the public to partner with us as allies in order to bring about an end to this pandemic. And so, we surveyed more than 6,000 of our nurses in August to understand their experiences through this pandemic. And what we found out was sobering. 2 out of 3 nurses have considered leaving nursing because of this pandemic. 9 out of 10 nurses believe the pandemic has depleted nurses at their hospitals, and 3 out of 4 surveyed agreed that people who hold out on getting vaccinated undermine nurses' physical and mental well-being. And so this campaign is really about letting the public know these numbers and our concern, and we're worried that the healthcare system is in peril because nurses are starting to leave in record numbers. They're exhausted physically and emotionally. And if nurses leave and our healthcare system falters, then more lives will be lost long after this pandemic. And so that's really at the heart of this campaign.
So we're recording this mid-November. I'm in Indiana, and our hospitalizations have ticked up a bit, but nowhere near the peak. Now, Colorado, I understand, is a hot zone with a surge in hospitalizations. Give us a read on what's happening. What are you seeing in your PICU?
Yeah, we are absolutely seeing numbers that are close to the highest that we've seen throughout this entire pandemic in Colorado. And as well, as you mentioned, I work in a pediatric intensive care unit as a pediatric clinical practice specialist, and we have seen a steady stream of COVID patients throughout this pandemic, but the numbers of hospitalizations in Colorado are climbing, and it's concerning, and it impacts more than just the folks with COVID. It impacts all of us because we're running short of hospital beds and we're running short of nurses to take care of patients. And so that impacts everybody. It impacts you, it impacts me, it impacts anybody who needs to receive medical care. And so right now it's concerning, and I think we're seeing spikes in other parts of the country as well. And so I think one of the messages is that we're not through this yet. And this is not just a wave that is impacting the unvaccinated, because the consequences impact all of us.
So, we keep hearing, and you just mentioned the whole bedside burnout issue and the stress that this puts on everybody who is bedside, the respiratory therapists, phlebotomists, everybody who's involved in patient care. Give me a sense of how this is different. How is this whole thing different than other critical care conditions that you face?
Well, burnout was a challenge prior to the pandemic, absolutely. But I've been a nurse for more than 35 years, and I have never seen and heard from so many nurses the level of exhaustion that healthcare workers are experiencing right now. Physical exhaustion, mental exhaustion, the degree of moral distress. And I think what's different now is that they've been showing up day after day through truly grueling conditions, witnessing unbearable deaths, lonely deaths for so many patients that we care for. And what we're seeing now is largely preventable if more people would get vaccinated. And that really truly adds to the moral distress that healthcare workers are feeling. I talked with a nurse just the other day, and she really described it as a loss of hope that things will ever get back to where they were pre-pandemic, and that we could provide the level of care and time with our patients that we really want to provide.
So combat fatigue is what it sounds like here.
Yeah, absolutely.
So 25%, according to a Kaiser Family Foundation poll, 25% of people say, no, I'm just not going to do the vaccine. And as it applies to children, that number is about the same. Another 30% of parents say, I'm going to wait and see. What do you have, either as part of your campaign or just general advice, for how we can talk about this across a Thanksgiving table without ruining our gathering?
Yeah, that is an excellent question, and really at the heart of this campaign. So we know that people still have questions about the vaccine, and that is why we are imploring vaccinated people within our communities to reach out to those within your circle and have a conversation. And so the Hear Us Out campaign contains a toolkit which really provides some steps that you can take to initiate a conversation with those in your circle where trust is already established, and initiate a conversation that is non-judgmental, that is respectful, that really conveys the message that I want to understand, I want to listen, and build that trust. And so the toolkit on our Hear Us Out campaign site provides those steps and talks through how to initiate those conversations, how to build that trust. And it also references a number of sites where folks can get real-time, factual, evidence-based data about the vaccines, about COVID. And so that's really at the heart of what we're asking the public to do. Those conversations aren't easy, and Thanksgiving, I think for many families, will be challenging because of the lines that have been drawn around this. But we really want people to think about how they can have those conversations in a way that respects the other's point of view and gets to the heart of where the hesitancy lies.
All right, I'll definitely put a link to that toolkit on both the Health Call Facebook page and up on the website. So that's Beth Wathan. She is a president of the American Association of Critical Care Nurses. Thanks for being here today, Beth.
Absolutely. Thank you so much for having me.
Sure. So we're going to jump from Colorado over to Florida, where Kevin Cho Tipton is a critical care nurse practitioner in Miami's public hospitals. Kevin, I think you heard our conversation. Anything you want to add to that?
No, I just want to say to Beth that I think what she's talking about on how to approach these conversations is on point. The only way that we can, I think, as healthcare professionals, talk to people is through how they see what's happening to them and to the country. There's so much discord between the social structures and the politics that surround COVID-19 that I think the only way that nurses and physicians and respiratory therapists that are at the bedside can combat what we're seeing is by education and by being understanding about what people know, what they don't know, and confronting the misinformation that we see.
Okay, you got me there. What don't I know? I mean, you've seen COVID at the bedside. You've seen the worst of it. You've watched people die from this disease. What do I need to know?
I mean, I think, number one, that every statistic we see on TV is a number, but all those numbers represent a person. In Florida, during the last surge from July to October, our hospitals went from, for instance, my facility went from 5 to 6 patients in each facility to hundreds. We were at a point where we had to cancel elective procedures and place ICU overflow units in operating rooms and post-anesthesia care units. There was a point when a Floridian was dying every 4 minutes. In fact, on Labor Day weekend this year, every 4 minutes, a Floridian died from this virus. And the vast majority, over 90%, were unvaccinated. We had a huge increase in cases. Many people got diagnosed, and people were anxious about those numbers. But the real numbers were those that are actually getting sick enough to go to hospitals. And ultimately, 1 out of 10 that ended up in a hospital didn't make it home. And all those numbers sound like statistics or math to be seen on the screen, but ultimately they're people. And I think that sometimes that we forget how to communicate, how that changes the life of a family, especially if they're a breadwinner or if they're a young parent with toddlers. I think these things are overlooked because of the bigger picture.
So give me a sense of what my ICU experience is going to be if I'm a COVID patient. What happens there as I'm severely ill? I don't think people really have a good idea on that.
Well, I think that's an interesting question, because for everyone it's different. But for a typical patient, let's say they'll be admitted to the ER and they'll see an ER technician, a nurse, a physician, a PA, or an NP, and they'll end up getting admitted if their symptoms and their laboratory values and their ability to breathe is bad enough. Once they go to the floor, they'll spend several days there. But if they continue to get worse, despite all of the experimental and conventional treatments we give them, they end up in an ICU, typically gasping for breath on machines, either through their nose or with their mouth or their entire face, to keep the oxygen levels just barely adequate. As they get more short of breath and their lungs become more damaged from the pressure we're using and the oxygen itself, they end up getting to a point where they're feeling like they're drowning, like they can't catch their breath. And, these people have been young and old, in their 30s and into their 90s. And all of them feel the same way. I can't breathe. And they become very anxious, often, and to the point we have to put them on a ventilator. And at that point, the risk of coming home drops to less than 50%, at least in the units that I've worked at. And I think that number, I think affects them personally. But we are communicating with their families over FaceTime or Zoom, and those numbers become very real to them. And facing mortality can be very difficult for all of them, especially once they're no longer able to make their own decisions.
Have you seen any vaccinated patients in your units?
Yes, about 6% of our ICU patients in the public hospitals in Miami were unvaccinated. A larger proportion, about 3 or 4% more, were there's a very large transplant community here. Were transplant patients who we knew that the vaccines would not be as effective as. So no more at any time were there 10% that were not that were fully vaccinated in our ICUs. Most were transplant patients, but some were everyday folks that just were unlucky.
So attitudes are changing about the unvaxxed. In Singapore, for example, if you're unvaccinated, the government will no longer pay for your care. In Germany, if you are unvaxxed, you're not allowed into many public places. So it's almost, there's an otherization of the unvaxxed that is happening in some parts of the world. What about in the hospital and the healthcare system? Do you get angry? Do you get frustrated? Are you upset with these patients when they're unvaxxed and they come to you and impose the kind of stress that it does?
I'm not. I will admit that it's frustrating to see what's happening. It's because, as Beth said, this is preventable mostly, and for the large part, 90% of these patients do not need to be here. And I think it doesn't make me angry. I know that some of my colleagues are frustrated with it, but for me, I'm just sad because over the last 2 years, nurse practitioners and physician assistants have had to had to practice at the top of our abilities to support ICUs that exceed 400% capacity. We're making calls to families to tell them what's happening, and regardless of if they decided to get vaccinated or not, these people are suffering some of the worst tragedies they'll ever experience in their life. And for me, I know that whether or not they're vaccinated, they're still people. They're still someone's loved one. And many of these people are my age. There was a point when 1/4 of our patients were under the age of 50. And I'm talking to their toddlers at home, and I'm talking to their vaccinated parents. And all I can do is feel horrible for them and devastated for what's happening and what's probably going to happen. To me, it doesn't make a difference. But yes, I think that there's been so much politicization and social constructs around COVID-19 that vaccination has become another way to, make your mark and determine how you're going to treat somebody. And I think that bothers me. Luckily, the AACN is one of many organizations that supports requiring vaccinations for our healthcare workers, and I think it is the right thing to do, and because nurses in general have some of the most trusted relationships with the community, and I think if we can use our political power and our personal power, we can prove that it's right and fight the misinformation, which I think is the primary culprit behind why people are being sidelined and why people are fighting the vaccine itself.
So what's your strategy? How do you speak with the unvaccinated and try to move them in your direction?
Well, as a critical care nurse practitioner in civilian practice, I talk frequently to families because, often I'll talk to them about monoclonal antibody therapy or the vaccine itself when I'm faced with their patients. Because as a critical care NP, I don't have a lot of interaction in the outpatient world. However, when I'm on a military status with the National Guard, we have now been able to evaluate, and we've been asked to speak to the personnel who are refusing vaccination. There are hundreds of them, just here in Florida, and I just simply listen to why they feel like the vaccine is not something that they should take. And what frustrates me is that many of them are becoming victims of the misinformation campaigns. They don't want it because it could cause sterility. They want it because I've really heard the microchips argument. And I think the only way that we combat this is not by judging them or yelling at them or hectoring them, but by listening to them and showing them on paper why this is not political for me, why this is not a news article for me. It's real life. I've lost over 200 patients in the last 2 years, and in the last surge, over 70% of everyone I put on a ventilator, and it becomes very real. And I talk about the stories I've heard about these people who have died as their children brought it home or as their kids from school brought it home. And there was a point in Florida, 9.5% of all Floridians over 65 that are not vaccinated or didn't get treated early and were exposed and got diagnosed died from the virus. In a school of 1,000 kids, that's 3 grandparents for every class of 30. And I think when we talk about the numbers in those very human terms, that's how we combat the vaccine hesitant that are being victimized by misinformation.
Misinformation, I agree, is out there. But for what about those people who are saying, I've had COVID, I now have natural immunity, I don't need a vaccine, I don't really feel like that's going to help me much, I'm young, I'm healthy, it's not really going to make a difference in my world. What's your input to those guys?
I think we need to be very careful when we talk about natural immunity. We don't have a full set of data that proves how long and how robust natural immunity is. I think I liken it to chickenpox, and I know that a lot of people don't even talk about chickenpox anymore because it's been essentially radically reduced in the community by vaccination programs in schools. But I say, number one, natural immunity is real, and I'm happy that they were one of the 99 or so percent that survived the virus. But for people that have natural immunity, we are not yet able to adequately determine how strong that protection is. And we have documented cases, some high-profile members of Congress who have been hospitalized after recontracting COVID-19. And I think that vaccination is the only true method in which we know that can provide consistent coverage and protection from the virus. At the same time, I think that we need to also focus on people in a way that is more meaningful. These conversations take emotional energy and honestly a lot of time to have. And I think that we should be focusing on people who this will have the most impact on. And I think that's people that have not been vaccinated and have not gotten sick from the virus itself, because I think there's only so much time that healthcare professionals have to spend on these conversations when also trying to take care of their patients.
And that's all the time that we have. Thank you. That's Kevin Cho Tipton. He is a critical care nurse practitioner in the state of Florida. And previously we talked with Beth Wathan, who is the president of the American Association of Critical Care Nurses. Thanks, guys. Appreciate your help.
Thank you, Lee.